Imagine this for a moment: you're carefully ascending a flight of stairs when suddenly, your foot doesn't quite clear the next step. You start to stumble and reach out to brace yourself, but your hand just closes on air. You hit the stairs hard, tumbling down several steps in a heap of pain and confusion. As you try to gather your wits and pull yourself up, you realize with a shock that you can't feel your foot or lower leg at all. It's like your limb has gone completely numb, with a terrifying pins and needles tingling sensation radiating outward. While the scenario I just described is jarring, it's also a reality that millions of people suffering from nerve damage face on a daily basis. That loss of sensation, unrelenting numbness, and constant tingling throughout the body can be debilitating, robbing you of basic motor function, coordination, and your very independence. Whether caused by diabetes, autoimmune conditions, injuries or infections, nerve damage often starts as a minor inconvenience. Maybe your fingers or toes go numb once in a while. Or you experience occasional tingling or burning sensations in your limbs that come and go. But left unchecked, seemingly minor nerve damage frequently snowballs into progressively worsening symptoms: muscles weakness, loss of reflexes, inability to feel temperature changes or pain, and severe immobility as nerve signals short circuit. The good news: by getting a head start on repairing nerve damage through proper vitamin supplementation and lifestyle adjustments, you can help stop this vicious cycle of nerve degeneration in its tracks. That's why today, we're going to dive into the 7 most critical vitamins and nutrients for rebuilding, remyelinating, and restoring the vital nerve pathways throughout your body. With many cases of nerve damage, the right nutritional support truly has the power to facilitate natural healing and recovery. So let's get started on giving your nerves the TLC they deserve. Who's ready to reclaim sensation, coordination, and overall improved quality of life? Vitamin number 1. B1, thiamine. When it comes to keeping nerves healthy and firing on all cylinders, vitamin B1 is an absolute must. This water-soluble vitamin plays a crucial role in synthesizing acetylcholine, the neurotransmitter responsible for activating muscles and motor nerves that control vital functions like breathing, heartbeat, digestion, and reflexes. An ongoing thiamine deficiency means your body struggles to produce adequate acetylcholine supplies, eventually leading to a breakdown in neuromuscular communication. This often shows up clinically as muscle cramps, weakness, loss of reflexes, and poor nerve conduction throughout the body. Severe, unaddressed thiamine deficiency can even lead to beriberi neuropathy, a devastating type of nerve damage that causes burning pain, muscle wasting, loss of feeling, and poor coordination in the legs and feet. Fortunately, suboptimal B1 levels are easy to correct through proper supplementation and consumption of thiamine-rich foods like pork, seeds and nuts, fresh vegetables like Brussels sprouts, asparagus and romaine lettuce, whole grains like brown rice and quinoa, beans and lentils. As an added bonus, vitamin B1 is also instrumental for helping nerves regenerate and rebuild protective insulation around nerve fibers that enhances signal transmission. So aim for at least 1.5 milligrams of thiamine daily to aid nerve repair and optimal function. Vitamin number 2, B6, pyridoxine. Vitamin B6, along with other B vitamins, is a powerful methylation agent that helps facilitate the regeneration and regrowth of peripheral nerves after an injury or damage. Pyridoxine is also essential for proper production and function of neurotransmitters like serotonin, GABA and dopamine that govern mood, sleep and overall nervous system communication. When B6 levels are insufficient, this impairs neurotransmitter pathways and hampers the body's ability to synthesize proteins and molecules required for nerve growth and repair. Over time, this increases risk. Vitamin number 2, B6, pyridoxine. Vitamin B6, along with other B vitamins, is a powerful methylation agent that helps facilitate the regeneration and regrowth of peripheral nerves after an injury or damage. Pyridoxine is also essential for proper production and function of neurotransmitters like serotonin, GABA and dopamine that govern mood, sleep and overall nervous system communication. When B6 levels are insufficient, this impairs neurotransmitter pathways and hampers the body's ability to synthesize proteins and molecules required for nerve growth and repair. Over time, this increases risk of debilitating nerve pain, worsening numbness and lack of motor control. Several studies show that B6 supplementation, often in combination with other B vitamins, can help improve symptoms of diabetic neuropathy, carpal tunnel syndrome and other nerve damage ailments. Higher doses of 100,200 mg per day may be needed for therapeutic benefits. Good food sources of B6 include poultry, fish and grass-fed meats. chickpeas, lentils and other legumes. Fortified cereals. Bananas, avocados and pistachios. Vitamin number 3, B12, cobalamin. When it comes to battling nerve damage, vitamin B12 is a heavy hitter that packs a powerful punch. This essential nutrient is required for myelin sheath formation, the protective insulating layer that surrounds nerve fibers and allows for rapid transmission of signals. Without adequate B12 levels, this myelin sheath becomes damaged and deteriorated, leaving nerves vulnerable to disrupted signaling, degeneration and impaired function over time. In fact, one of the first signs of B12 deficiency is often burning, tingling and numbness in the hands and feet caused by demyelination. Vitamin B12 also facilitates DNA synthesis and neuronal metabolism processes that are critical for repairing injured nerves and promoting regeneration of new, healthy nerve tissue. Several studies show that B12 supplementation, especially when combined with other B vitamins, can effectively treat and potentially reverse many types of nerve damage. To get therapeutic doses for nerve repair, you'll likely need to supplement with B12. Optimal daily dosages range from 1,000 to 5,000 mcg per day, often in the form of methylcobalamin, which is better absorbed than cyanocobalamin. You can also boost your intake through B12 fortified foods and quality sources like beef, chicken and fish. Dairy products like milk, cheese and yogurt. Eggs. Nutritional yeasts. Vitamin number 4, alpha-lipoic acid. This potent antioxidant vitamin plays multiple roles in safeguarding nerve health and facilitating repair of damaged nerve pathways. As a powerful anti-inflammatory, alpha-lipoic acid helps quell oxidative stress that leads to nerve degradation. It also helps recycle and recharge other antioxidants like vitamin C and E to maximize their protective effects. But where ALA really shines for nerve damage is its ability to improve insulin sensitivity and help regulate blood sugar levels that are often the driving force behind diabetic neuropathy and other forms of nerve degeneration. By lowering oxidative stress and improving glucose uptake into cells, ALA helps halt and even reverse some of the nerve damage caused by uncontrolled high blood sugars. Studies show that supplementing with 600–1,200 mg of ALA daily, sometimes in combination with other vitamins like biotin, can significantly improve symptoms like pain, numbness and tingling associated with diabetic neuropathy within as little as 3 weeks. It may also aid in the regeneration of nerve fibers and functional recovery over time. While ALA is produced in small amounts by the body, you can boost your intake by consuming more foods containing the vitamin. Organ meats like kidney, liver and heart. Spinach, broccoli, tomatoes and potatoes. Grass-fed meat and free-range eggs. Vitamin number 5, vitamin C. Vitamin C also enhances the absorption of other critical nutrients involved in nerve repair, namely the B-complex vitamins we just covered. It helps recharge vitamin E to amplify its antioxidant capacity as well. But one of vitamin C's most impressive roles for nerves lies in its ability to catalyze collagen production. Collagen isn't just the structural protein that gives our skin elasticity, it's also a key component of the myelin sheath that insulates nerve fibers and optimizes signal transduction. By boosting collagen levels, vitamin C revs up production of new myelin to remyelinate damaged areas and restore rapid nerve communication. It also strengthens the connective tissues and extracellular matrix surrounding nerves to enhance their structure and protection. When combined with vitamin E, studies show vitamin C can help reduce pain, paresthesia and other symptoms in people with diabetic neuropathy by improving nerve blood flow and fortifying nerve fibers against oxidative stress. To get therapeutic dosages for nerve regeneration, most experts recommend supplementing with 500–1,000 mg of vitamin C 2 times per day. You can also load up on vitamin C-rich fruits and veggies like citrus fruits, bell peppers, broccoli, Brussels sprouts, tomatoes, strawberries. Vitamin number 6, vitamin E. This fat-soluble powerhouse vitamin teams up with vitamin C to create an unstoppable antioxidant force that protects nerve fibers from the ravages of oxidative stress. By neutralizing free radicals, vitamin E stops these reactive particles from damaging proteins and lipids that make up nerve cell membranes. It also inhibits the inflammatory pathways that can disrupt nerve function and accelerate degeneration. Studies show people with higher vitamin E intakes have better nerve conduction velocities and lower rates of issues like carpal tunnel syndrome. But vitamin E doesn't just play defense, it's also actively involved in promoting nerve growth and regeneration after injury or damage. The vitamin stimulates the production of the neuronal proteins required to regrow damaged axons and remyelinate nerves for optimal signaling. For diabetic neuropathy in particular, research indicates supplementing with a combination of vitamin E, 900-1800U daily, along with vitamin C may help reduce pain, numbness and tingling, improve nerve conduction velocities, enhance neurosensory perception, increase blood flow to nerves. Since vitamin E is fat-soluble, it's best to get it through dietary sources like plant oils like wheat germ, sunflower and safflower oil, nuts and seeds, green leafy veggies, fortified cereals. Vitamin number 7, B9, folate, folic acid. Our final vitamin for nerve repair is the often overlooked B9, also known as folate or folic acid. This essential B vitamin teams up with vitamins B6 and B12 to control homocysteine levels in the blood. Elevated homocysteine is a significant risk factor for nerve damage, as it increases oxidative stress, triggers inflammatory reactions, and can directly injure nerve cells over time. By regulating homocysteine, folate helps create a less hostile environment for nerves. But folate's benefits extend far beyond just lowering homocysteine. It's also required for proper myelin synthesis to insulate nerve fibers and neurotransmitter production for optimal nerve signaling. A folate deficiency can severely impact these processes, contributing to demyelination and nerve transmission issues. What's more, folate aids in DNA synthesis and cell division, two crucial mechanisms involved in regenerating new nerve tissues to recover from injuries or neuropathy. By fueling this growth, folate helps remyelinate and restore nerve structures. Most adults should aim for at least 400,600 mcg of folate from sources like leafy greens like spinach and romaine lettuce, citrus fruits, beans, lentils and peas, nuts and seeds, fortified grains and cereals. For an added nerve protective boost, look for folate in its most bioavailable form, methylfolate. This form can cross the blood-brain barrier more readily. The takeaway: there you have it, friends, the 7 most critical vitamins for stopping nerve degeneration in its tracks and facilitating the regeneration and repair of damaged nerve pathways throughout your body. From vitamin B1's role in synthesizing acetylcholine to vitamin C's antioxidant protection and collagen production for remyelination, each of these micronutrients plays an essential part in combating nerve damage. And when you combine them into one comprehensive nerve repairing regimen, well, that's when the real magic happens. These vitamins join forces to create the absolute ideal environment for quelling oxidative stress, stamping out inflammation, and allowing your nerves to rebuild and heal. Of course, beyond just supplementing with these 7 powerhouse vitamins, there are some other lifestyle strategies you'll want to embrace for maximum nerve repair. Control blood sugar levels, since chronically high blood sugars are one of the leading culprits behind nerve damage. Getting your glucose levels into a healthy range through diet, exercise and medication, if needed, is paramount. Up your antioxidant game. Loading up on antioxidant-rich fruits, veggies, herbs and spices will give your vitamin routine an extra boost while further minimizing oxidative stress on nerves. Stay active. Low-impact exercise and movement helps improve circulation and oxygen delivery to regenerating nerve tissues. But avoid overexerting damaged nerves. Identify and treat underlying causes. Whether it's an autoimmune disorder, vitamin deficiency or injury triggering your nerve issues, work closely with your doctor to find and address the root problems. Embrace stress management. Chronic stress takes a major toll on the body and can worsen nerve degeneration over time. Make relaxation practices like meditation, yoga and massage priorities. The road to repairing nerve damage can undoubtedly be a long and challenging one. But by giving your nerves the comprehensive vitamin and nutrient support they so desperately need, you'll be actively facilitating their natural healing capabilities. So stay positive, stick with your supplement routine, and lean on those lifestyle strategies. While it may take some time and diligence, taking a proactive approach with vitamins gives you a powerful edge to combat numbness, tingling and burning nerve pain. You've got this. Here's to taking the first steps towards restored sensation, better mobility, and reclaiming the active, pain-free lifestyle you've been missing. Thank you for watching this video. If you enjoyed the video, please like and subscribe.